And now, Yahala with Dr. Abu Shanab, brought to you by Bridgeview Chiropractic.
أهلا وسهلا مستمعينا الأعزاء في حلقة جديدة من برنامج ياهلا مع الدكتور أبو شنب. معكم يوليا ريحاني في التقديم وخالد خلفة في الإخراج، وأكيد بشرفنا نرحب بضيفنا الدكتور رشيد أبو شنب. أهلا وسهلا.
أهلا وسهلا. Thank you very much.
يا هلا مع الدكتور أبو شنب، برنامج يأتيكم كل يوم اثنين الساعة 4:30 بتوقيت شيكاغو على راديو يا هلا فويس. برنامجنا بيقدم لكم توعية صحية ومعلومات ضرورية حول كل ما يتعلق بعلاج العظام وآلام الظهر والمفاصل وإصابات الحوادث وغيرها من المواضيع المتعلقة بالعلاج اليدوي أو الطبيعي وتقويم العمود الفقري. وهلأ اسمحوا لي أعرف بدكتور رشيد أبو شنب. دكتور أبو شنب earned his doctorate degree from National University of Health Sciences in Lombard, Illinois in 1997. He was a faculty member at the school until 2000. He earned his degree as an independent medical examiner in 2004 and his master's in advanced clinical practice in 2012. Now, Dr. Abu Shanab has two clinics, one in Bridgeview and the other in Romeoville. Doctor, welcome again to our show. Our show is mostly in English يعني ورح نحاول نترجم بعض المصطلحات للغة العربية. واليوم رح نتناول ورح نحكي عن موضوع كتير مهم ناس كتار بيعانوا من هاي المشكلة، وهي الروماتيزم. الروماتيزم شو أنواعه وكيفية علاجه، سواء كان عن طريق الأدوية أو عن طريق العلاج الطبيعي أو الأساليب الطبيعية. هلا إيش هو بشكل عام الروماتيزم؟ ماذا يعني؟ What does arthritis in English mean?
Well, أولا, thank you very much, Yulia, for having me. After the introduction, I feel like I'm an old guy.
No, you're not.
So,
كلك شباب دكتور.
Thank you. But arthritis is such a big topic.
It is.
And many people have that issue, and we see this very common in the clinic, and we hear about it in TVs, radios, and everywhere. But the word arthritis in general, it's actually divided into two words. It's the word arthur and itis. The arthur, it means just the joint. It's the joint anywhere.
Sounds like a name, Arthur.
This is exactly how we discuss this. When the patient come in, we'll say he has arthur. But itis, it's inflammation. So when you say arthritis, it's basically a joint inflammation that
التهاب المفاصل.
That causes the pain, the stiffness, the swelling in the joint. And it's very much the inflammation, when you think about it, when you hit something or you hit something with your elbow or something, inflammation is a normal, natural reaction to anything. Includes the swelling, stiffness.
Right.
It's a normal thing.
Yeah.
But what is not normal is this inflammation that lasts for a long time.
It develops to an illness called arthritis,
That's
which
correct.
means rheumatism. And we're going to talk later on about the causes, what causes the arthritis, how to treat that. We're going to talk in details all about it, all about the arthritis. But first, let's see what types of arthritis do we have.
Arthritis, actually, it's many types. There is like three most common arthritic changes that we see. The most important one, the most common one, thank God, is something called osteoarthritis. And it's the one where the bone-on-bone kind of appearance. It's also known as degenerative. It's the one that happens with older people. What I mean by older, 40 plus.
Yeah.
So by far the osteoarthritic, it's the first one that's very common. We
Osteoarthritis.
See. The second one that we commonly see also something called rheumatoid arthritis. And the rheumatoid, it's an inflammatory response where your immune system mistakenly attacks itself, causing swelling, causing misshape in your fingers or the toes. It really affects, this rheumatoid affects any joint in the body except your spine. The spine more common to be in the degenerative joint. which is the first one.
So the problem is in the immune system,
It's your immune system,
basically.
yes, where it attacks itself, and it's an autoimmune disease, which is the rheumatoid. The third one, which is the gout, which is in a lot of people in Arabic language we call that rheumatism al-muluk. And the reason why rheumatism al-muluk, it's have to do with diet. You know, people who eat more rich protein like meat, cheese, dairy.
Oh.
That's the one that's common, and it's not per se just don't eat those meats and that's it. It's
It's how your body maybe deals with those kind of products
yes,
and
by
overeating them.
overeating by accumulating something called uric acid.
Yeah.
So any excess uric acid forms develop into crystals, and this is the one that found in the small joints, usually in the hands, and very common in the toes.
Usually people that lift heavy weights, they eat a lot of those kind of foods, the meat and eggs and protein.
Yeah, but you know, with the weight and lifting and stuff, it could be anything, you
It
know,
could be
but
anything.
it could be osteo, you could have rheumatoid, you could have the gout. It's not specifically people who lift weights for that specific arthritic change.
طيب دكتور، خلينا نركز على الروماتيزم الأكثر شيوعاً اللي هو الأوستيوارثرايتس. يعني how do we feel pain when we have osteoarthritis?
Osteoarthritis is very common. It happens to over 80% of the people. Pain, it's a warning system. It's alerting you there is something wrong. It's like you can say it's a flag. There is a specialized condition in the nervous system, small little nerves called neurons. Those transmit the pain signals that found in your skin, in your back, in your joints, and the cells respond to things as inflammation or tissue damage. Well, I'll give you an example. For example, if some knife hits you or you know hit your skin or hand, those neurons come to the brain and they show up as pain. Same neurons that develop because of the knife, they come in from the arthritis too. When the joint become a little bit smaller and the cartilage become bone on bone, that's how we feel the pain. Those neurons become pinched, and that's how a little by little this will develop into arthritis.
Remind us, Doctor, how common is it to have osteoarthritis, and what are the age, خلينا نحكي average age when people have this kind of sickness, illness?
The osteoarthritis is very common. It's as I mentioned, over 80% of people have that. The very common age for it is people over 40 years old, but we've seen it as age of 20, 25 years old. It depends on many factors, but the age specific, I would say most common to be over 40 years old.
And can it develop to younger patients?
Yeah, if there is an issue with, if they have specific inheritance to certain cartilages that they develop, if they have some kind of curvature in their spine, like scoliosis, that also can develop at early age. Any injuries, accidents, that absolutely, they can definitely develop it as well.
How could the patients detect that they have arthritis? What are the symptoms?
There are many symptoms involved. Most common to be limitation of range of motion, meaning if somebody at a younger age, they used to touch their toes. As they age, they are not able to do this anymore. Or when they used to drive, they used to turn their head, be able to turn their neck all the way around. Now they
Oh,
just...
really? Can someone do that?
Then after a while, they stop doing that and they just
Yeah.
look at the camera the car give them. So limitation of range of motion, morning stiffness, joint swelling, like around the knees especially, very common. Some kind of popping noises upon movement or sitting to standing. That's all kind of symptoms of arthritis too.
And the most important question, what يعني causes this symptoms, and what causes arthritis in general?
Arthritic causes, it ranges for many things actually, but the most common thing that we see is injuries. People who were involved in a car accident, yeah, they just have a little pain here and there, but after a while, this injury might develop into arthritic changes. Other things that causes arthritis is overweight. People who are, higher according to their height and weight ratio, they will put more pressure on their knees and ankles and their backs, and of course that also develop into arthritis. In addition to that of the injury and overweight, some people actually inherit the defect of the genes responsible for making cartilage, and that cause also arthritic as well. Even posture
Is there a way to prevent that?
with inheritance thing,
Yes.
it's really kind of hard to say because that's people with rheumatoid, uh, some people with scoliosis and curvature. It is a little bit difficult because by the time you find it, it's already too late. Other causes, possibly it's overuse, and what I mean by that, it's people in jobs who sits down like how you're sitting right now,
Yeah.
Yulia,
I'm
bending
trying to fix the way I'm sitting.
bending, yeah, bending your head forward,
Uh-huh.
looking at the monitor all the time, crossing the legs. That also increases the amount of osteoarthritic changes as well.
Also, the runners, the active runners, no?
Yeah, because it's not per se because they're running. It's how they run. If they have flat feet, not flat feet. If they use the correct shoes to actually help them out to run. So not all their weight sits on their knees specifically on the same joint over and over and over.
So the weight loss is understandable, but what kind of accidents that cause arthritis?
The accidents more common to be like an auto injury, for example, a whiplash injury. What happened, that specific segment in the neck, let's say people who have pain in the mid back, and that's very common to be at C4, C5 level, which is about an inch lower than your ear. That is the joint that become a little bit more injured. So the amount of circulation, the amount of blood circulation to it will diminish. And that will start to look into arthritic and become into a little bit more inflammation. So car accidents very common. The same thing is work injuries, like when somebody left a box or something, they start to have a pain. Again, just like what we discussed earlier, how is the pain is like a flag for you to know there is something wrong.
Right.
And also that will increases by make a little bit bony enlargement around the spine or around the hand, and that goes into inflammation, and that's how the arthritis develops.
We were talking about the causes of the arthritis and the symptoms, and now I'd like to know, how is it diagnosed?
The diagnosis is a lot to do with the patient presentation, as I mentioned earlier. When the patient come in indicating they have morning stiffness, pain upon not being active versus pain getting better with activity, limitation of activity, not walking as much, that, part of the diagnosis. But the other thing that we really have to really look at is the x-rays. The x-rays will show the arthritic changes. Also an MRI or a CT scan that will also show the actual joint anatomy, and it will show more of how the discs and the cartilage are presented. So besides the patient's presentation, we really look at other diagnostics, and that will tell us mostly about the arthritic changes. There is some blood blood testing that we can do, but this is the one that we see mostly for the rheumatoid and the gout. But the osteoarthritis, it will look normal on the blood. Like when you do a blood test, it will be a normal blood test. You will not see it on regular blood test.
Oh, really? Okay, so let's say a patient is diagnosed and he has arthritis. How do you start the treatment? How is the arthritis treated?
This is really a great question, Yulia. Arthritis is there is not specific treatment for everybody. It's not like a cough or a flu, and it's like you take one thing and that's it. Osteoarthritis is treated by all the above: exercises, weight loss, some medications, physical therapy, muscle strengthening exercises, even some kind of changes in posture. And we even have patients who unfortunately have to do surgery to do relieve some of the symptoms, like arthroscopic for the knees or so.
I see. But what kind of medications and medicines do the patients take during the treatment process?
For medications, when you talk about medications, you really have to think about some of the side effects too, especially for arthritis because it's a chronic disease. People have it for a long time, and you can't just keep taking the medications for it 100%. We have to find a method. Some of the medications that is common are the non-steroidal anti-inflammatories, like things over the counter, Advils, Aleve, or some even naproxen. And the issue with that you really have to think about is bleeding, gastrointestinal bleeding, like stomach bleeding, ulcerations. This is very, very important.
So you fix one problem and then you cause another
That is
another problem.
this is the issue, and not only the gastrointestinal. Some other medications have problems on the congestive heart failure, some kind of kidney diseases, renal failure, and even high blood pressure.
So doctor should be in control when the patient decides to take such medications.
Yes, absolutely. You have to discuss that with your doctor just to know what the pros and cons. So with that, some people say, "Oh, I just want to get rid of the knee pain, no matter what the cause is," and this is such a decision that you have to do and discuss that with your doctor. But there's other things, like exercises, swimming, walking, or even decreasing down the stress on the joints by using some kind of braces or taping methods that
Right.
just like how our parents did.
Is that considered as an alternative treatment, or it should go hand in hand with the medications and maybe surgery even?
It can go hand by hand, but the medications, coming back to that, besides the ulcers and stuff. If you remember the television commercials about Vioxx and Celebrex in the good old days, actually, the Vioxx and Celebrex, they were very, very important and very famous because they did not have any side effects on the stomach. They are classified as COX-2 inhibitors, which are second generation anti-inflammatory drugs that cannot or will not cause a digestive problem. However, after a while, research showed that those type of medications increase the risk of cardiovascular disease. So, just like you said earlier, you fix something, but the other thing is not. Some people take some medications, but a lot of them think about just use the brace, just use acupuncture, just use physical therapy, just use chiropractic. That's what really help a lot as well. So doing hand by hand, that's great. And instead of you taking 7 to 10 tablets of certain medication, maybe if you do both things, your medications will go less and less. That will be helpful a lot for the arthritis.
Yeah, Dr. Rashid, how do I advise the patients to cope and live with the arthritis? Is there any other things that they can take, just such as vitamins, any specific vitamins?
There is a lot of vitamins available. There is nutritional supplements like glucosamine sulfate. A glucosamine sulfate, for example, is a sugar made and found in the joint. And as we age, this glucosamine sulfate actually diminishes and goes down. And instead of having X amount of it, as we age, the glucosamine goes down. So taking some supplements that have a glucosamine chondroitin, that would help a lot with the joint itself. The second one that's very common is the chondroitin sulfate and the MSM. Those two are both good anti-inflammatories, natural method, and you cannot have those from the food. Those have to be nutritional supplements because those used to be in your system, as I mentioned earlier, and they are no longer there.
Yeah, and doctor, you don't need a prescription to go to the pharmacy and buy those vitamins. Anyone can take them?
Correct. Those are over the counter. But if you have them all as mixture, that's better off. Like if you have the glucosamine sulfate and chondroitin and MSM together in one capsule, that's excellent. Then there is a new research actually adding fish oil to this.
Yeah.
So you have one capsule of fish oil, glucosamine sulfate, chondroitin, and MSM in one tablet. And that makes the vitamins go into the joints way more effective and way more faster versus just a tablet.
And besides the medicines and the vitamins that you've mentioned, Doctor, is there any other treatment associated with osteoarthritis?
Um, Very common treatment that we use at our offices are chiropractic treatment to manipulate the spine and restore the joint mobility and increase range of motion. That will help a lot with the osteoarthritis. The use of heat and cold compresses to increase circulation to the joint. That's very important. And a lot of people with osteoarthritis, especially for the knees and ankles, they like the heat sensation to it. I mentioned earlier about joint protection using brace and some kind of taping techniques to actually decrease down the amount of pressure on the joint. The massage therapy that will increase a lot of the kind of circulation to the specific muscles and that increase circulation to the joint to make increased range of motion to it. There is electrical stimulations, and this is very common too. A lot of patients have it, something called TENS unit, and it's like a small device that you can apply on your neck or lower back, and that increases the circulation. There's things like acupuncture, and those are the ones that very specific in the neck, lower back, knees, ankles, and they are small little needles can sit into the joint to increase circulation, and it has a lot of power in it. And too many research swears by the acupuncture and the treatment for it.
Doctor, how do you choose the kind of treatment? Is it different from each person to another, or you can use them all to any kind of osteoarthritis?
A treatment that we use, depending on the patient presentation. I mean,
Yeah.
some patients we cannot use manipulation for them if they are in a specific age or osteoporosis or some kind of condition that we cannot perform the manipulation. And for the electrical stimulations, people with pacemaker or any kind of device like that, we cannot use the stimulations. So it's all depending on the patient condition. That's why we have many options that we can definitely help the patients with. But if somebody have a knee arthritis, we really have to look at their feet. If they have flat feet, no matter how much we do on the knee, we have to address the idea of the feet too.
So it's very individual. Each case is treated in a different way.
Correct. And also, I mean, the most important thing, you know, diet and exercise, that's what really going to help it the most too.
It's for everyone. It's a general advice.
Correct.
A treatment for everyone. And that's how I would like to end our show with this question. What kind of lifestyle, Doctor, يعني, very briefly, would you recommend to people that have arthritis?
Like we discussed earlier about the eating healthy diet, using 8 to 10 hours of sleep at night, you know, relaxation, choose a caring doctor that actually can be able to help you out and take you to the next level. That's huge. Join a support group, people who have arthritic changes on regular basis to see what they are doing. Drinking a lot of water, decrease down diet, and
Are there any kind of specific foods that people should eat?
as far as the food, for the gout part, you know, the cheese, the meat, a lot of the dairy stuff that will affect the gout. But for the osteoarthritis, it's really related mostly about the good diet, which is the caveman diet, which like fruits and vegetables. That's all pro deflaming of the spine, and that's what makes you a little bit better off overall, not only for osteoarthritis, but all types of arthritis.
And Dr. Rashid, you mentioned earlier the acupuncture. Is it, let's say, good for all cases of osteoarthritis?
It's very much if the patient allows us to perform,
Yeah.
because a lot of people are afraid of the
I
needles.
see the needles. Oh no.
The arthritis, the acupuncture, we can place them anywhere. We can do them on the hands, on the knees, and the ankles, and the feet, on the back. It's very effective, and they do really good for arthritic changes, especially for the knees.
So to repeat, the majority of the cases, it's 40 years and older, the people that have osteoarthritis, but you'll also have younger patients. And the causes could be from accidents, all different kind of accidents, to genetics, to other reasons, maybe like sitting for longer hours behind a desk or running in an inappropriate way.
Yeah, it's the arthritis for younger patients is not as the osteo part, of course, the osteoarthritis for younger patient is not as common because your cells are still building up. Up to about age 40, then after that, those cells that are building up are diminished in size, and the other cells that actually breaks down the cells are increasing in size. So most common osteoarthritis is 40 plus, but yes, we do see them at a younger age, but this is depending on previous injury or specific area of misalignment of a bone for long term that wasn't looked at.
Thank you, Dr. Rashid Abu Shanab, for all this valuable information regarding the arthritis and specifically osteoarthritis. We would like to thank you again for joining us today in the show Yahala مع Dr. Abu Shanab.
Thank you for having me.
I would like to remind our listeners regarding the addresses and phone numbers of your two clinics. The first one is in Bridgeview, and the number is 708-233-0707. It is at Harlem and 83rd Street, and the address is 7124 83rd Street in Bridgeview, Illinois. The second clinic is in Romeoville, and the number is 815-293-3000. And the address is 600 South Weber Road, Suite 9A, Romeoville in Illinois. And, of course, the website, drshanab.com, drshanab.com. And I know, Doctor, that one of the clinic is expanding, the one in Bridgeview.
Yes, actually, we are adding an additional 6,000 square feet to our 3,000 square feet, and we are actually adding a neurologist, an internist, we're adding a pharmacy, as well as a possible dentist. So it's trying to be a one-stop for all the conditions that any patients have. We definitely will be able to help them out and do the best we can to treat.
شكرا لك دكتور رشيد أبو شنب. مستمعينا الأعزاء، بتمنى أن تكونوا استفدتوا من هاي المعلومات القيمة حول الروماتيزم. استمعوا لنا في حلقات قادمة. أطيب المنى مني يوليا ريحاني ومن خالد خلفة ومن الدكتور رشيد أبو شنب، وإلى اللقاء.